evening. My name is Nicole Hurling. I'm your host today for the Parent Advocacy Program. Today's program, we're going to focus on eyesight in children and what parents should do if they have any concerns with their eyesight in their children. So come right back and we'll delve into that topic deeper.
Chill out. Don't tell me to chill out when you're stealing my things. I wouldn't have to raise my voice if you would just give it back and stop being like a criminal.
I don't have your cell phone.
Oh God, look at yourself. What are you offering?
Is this a thief's uniform? You see all these people standing around here? Why am I the one?
I'm sorry, homie. Okay?
What?
Don't make this a big deal. Just give it back, okay?
Did you see me?
Yes, you know, I just know you took it.
Where are your witnesses?
Look at
Where are your witnesses? What? Did you see me? Did you see me?
Hey, you left us in the bathroom.
Hello everyone, welcome back. I'm your host today, Nicole Hurling. I'd like to introduce my guests for the show today. I have Robert Barbera. Did I pronounce your name correct?
Barbera.
Barbera, thank you. And Dr. Stephen Honor. Is that correct?
Yes.
Thank you, and welcome to the show today. As I mentioned, we're discussing what parents can do and services they can go to if they feel their children may have difficulties with their eyesight. So let me start with Dr. Honor. Can you explain a little bit what you do?
I'm a pediatric ophthalmologist. I'm an eye surgeon and I work at Children's Hospital. And I am responsible for examining infants and children. Children get sent to our offices for any concerns that have to do with their vision, whether it's a baby who's not tracking and following well, or if it's an older child who's failed a vision screening. And we evaluate the children and decide if they have a medical problem that can be treated, or sometimes children come to us who might be legally blind or have a visual impairment, and I will contact the New York State Commission for the Visually Impaired. Mr. Barbera is our local liaison for that. He's the consultant for the Children's Services, and we are fortunate here in Western New York and Buffalo, we have lots of services available for children who are having trouble seeing.
Now, how long have you been doing that for?
I've been in practice 15 years.
In your practice, you've seen a progression, I'm sure, an improvement in treatment and technology for eyesight disorders. Is that correct?
Mm-hmm.
Okay.
Sure.
Have you noticed has been, with the children you've seen recently, has it been more hereditary, more environmental, a little bit of both? What have you noticed?
There are a number of different disorders that can cause a child to not see. Some of those have changed over the years. Many, many years ago, 30, 40, 50 years ago, some of the babies born prematurely would develop blindness, and those were things that couldn't be treated then. Children could be born with cataracts or glaucoma, and the treatments were not successful. Over the last 25 to 30 years, there have been a lot of improvements in medical science and technology, and some of those have allowed people like myself to take care of these infants and children differently. So now it's much less common to have a child born with a cataract or for a premature baby to end up blind from that problem. I do see children who cannot see in one or both eyes because of something that they were born with that we can't treat. For instance, they might be born with a small optic nerve, or they might have a hereditary condition that one of their parents had, or sometimes they have a hereditary condition that neither parent had. Things like aniridia, albinism are just some of the disorders that I take care of. A much more common thing that I see is children who come in the preschool or school age who have failed a vision screening.
Okay.
And either the parent noticed a problem or their pediatrician, or if they had a vision screening through Head Start and discovered that either they were not seeing well in both eyes or they were not seeing well in one of their eyes. And so there are lots of children I take care of who might just benefit from eyeglasses, or some children need to wear a patch over one eye because they have one eye that's seeing and one eye that's not. We call that amblyopia. That's something that's very treatable. When I have kids who are having a visual impairment in both eyes, then I end up recommending, depending on their age, they might be declared legally blind, and that allows them to then get services. And the definition of legally blind is someone who doesn't see 2200, or if they have good central vision, they don't have any peripheral vision.
Okay, now kind of going on to the services, I'm going to go to you, Robert.
Okay.
You are legally blind, is that correct?
Yes, I've been legally blind since birth.
Since birth, okay. Was your eye disease, if you call it, was that hereditary?
No.
No.
It was just a congenital condition.
Okay, all right. And you do offer services through the school districts, is that correct? Or through the county, shall I say?
We
Well,
are.
not you, but
We are a New York State agency. We are part of the New York State Commission for the Blind is part of a larger agency called the Office of Child and Family Services. We're supported by your tax dollars. So my funding is all New York State funding. We do offer other programs. I specifically work with children. We do serve from birth through adulthood, but my program specifically focuses on the children.
okay. All right, and how many, again, you service 8 counties, right, or all of Erie County?
Correct.
And how many children do you service, would you say?
Right now, I'd say the size of my caseload is about 150 children right now.
Okay. Now, when you service these children, what do you primarily do with them? Or like you're the liaison, is that correct?
Correct.
Yeah. So how does that work?
Well, when I get a referral, usually, most times it comes from the ophthalmologist. Sometimes it comes from other sources. Sometimes it's direct contact through the parents. First step is that we need a diagnosis of legal blindness from an ophthalmologist. So once we get that, I will typically go out and visit the family at their home for the first time. Occasionally they will come into the office, but most times I'll visit the family in their home. Just to make it more comfortable for the parents and the child.
They must appreciate that. I know I would. Okay.
Yeah. So plus, you can also see the child interact in their own environment.
Sure.
And it depends on when I get them. I can get kids. I've had children that were diagnosed around 9 years old. So of course, you do things differently than when you get a child who's diagnosed at 18 months old.
Right.
But the first step would be to let them know what services that we have to offer. And a lot of those services depending on whether the child's 18 months versus 9 or whatever. Some of the services that you would offer an older child, like a summer camp, you would definitely not offer to a little child.
Right.
But the first step would be to make sure they're connected with other services. If they're early intervention, I would want to make sure that their county early intervention is aware of them so they can get services through their county. So if they lived in Buffalo, they'd be through Erie County, and they would contact the Early County Health Department of Early Intervention.
Okay.
And I can help them make that referral. If they're preschoolers, the same thing. I would want them to contact their local school district. A lot of those services that they would be getting would be through, if they're little, I'd want to make sure they first have a teacher of the visually impaired, which is for early intervention funded through the county, but for the older children is funded through their school district.
Is it pretty? The steps you're mentioning, are they pretty easy? It's a pretty easy outline to go through. There's not a lot of hoops they have to go through to do these steps.
No, I think the biggest point is what I want to make sure is, because the parents are given this diagnosis, so in the beginning they're feeling overwhelmed.
Sure.
What I want them to know that there's hope for their child, that their child can get the proper education, and typically most children today are in regular inclusive settings, in regular school districts, but I want them to get a sense of hope and make sure to make the process easy for them. Initially, it may feel complicated to them, but I want to try to alleviate it as much as possible, so I work with them. And I would say it's a simple process. Of course, I'm not in that position. The parent is.
Okay. Do you follow the children throughout their entire school life?
Yes. So if I get a child who is a young child, a 6-month-old, I will keep that child up until at least the age of 14 or up to 21, depending on the situation. Those children, now we're getting into a different area, but if those children who have vocational potential, we will transition them as early as age 14 so they can participate in the same summer work experiences that their sighted peers would participate in. Some kids it's a little bit longer, might be 16, 17, 18, depends on, if they have other impairments, we may want to wait a little bit longer. If they're going to be in school till age 21, I may keep them a little longer. Typically, though, if you have a child who is just legally blind, who has no other impairments and is capable, we will try to transition them as early as age 14 so they can get the same opportunities that their sighted peers are getting for summer employment.
Okay. Very exciting. Very exciting. Now, Dr. Anwar, when should a child get their eyesight done to check out their eyes? What's a good age?
Well, children start actually when they're born.
Okay.
When a baby's born in the hospital, the pediatrician will come in and do a physical exam before the child leaves the hospital. And one part of that is checking for something called the red reflex. People are familiar with that when you take a picture and someone has the red eye. That's a normal reflex of the blood vessels inside the eye through the pupil. So the pediatrician is actually looking for that. And at each of the well visits, when the baby comes in at a month, 2 months, 4 months, 6 months of age, throughout that first year of life, they're going to have the pediatrician look at that reflex. Parents are always very attentive to, is my baby seeing? And there's a natural development of vision. The eyes at birth are not fully developed. They take time to mature, as does the brain. So for the first 3 to 4 months of life, some babies will cross their eyes or the eyes will float apart, and that's normal. Typically between 4 and 6 months of age, the baby should be focusing and looking at the parents in the face and following things. A lot of young babies, if there are other older children in the house, they'll sit in the high chair and they won't take their eyes off their older brother or sister. That seems very engaging to the young babies. More interesting than the adults are.
That's children, period, and teenagers, but go ahead.
Yes. And then what we recommend, and the American Academy of Pediatrics and my organization, which is the pediatric ophthalmologist, that children have their vision screened, if possible, in the pediatrician's office when they're about 3 years of age. Some children it's easy to do that, some children it's very difficult because they may not have the attention span or the interest in participating in that. If they don't do it at age 3 years, we certainly want them screened when they're 4 years of age. A lot of preschools will provide vision screening, and once the children get to the school age, kindergarten and above, most of the school nurses here in New York State do a fabulous job of screening the children. Some families will have a history of a child having a lazy eye, or one of the parents themselves might have had something like that as a child. So those families, we try to encourage them to have their kids screened by an ophthalmologist when they're 3 years of age.
Okay, well, hold that thought. We're going to come right back because I want to delve deeper into that, and also I want to ask, what are the next steps if you find there's a problem with your vision. So come right back, audience. We're going to delve into that topic a little bit deeper.
Different words describe different people. But in the eyes of the law, there's one that fits us all. Human right number 7. We're all equal before the law. What are human rights? Find out at youthforhumanrights.org.
Welcome back. This is Nicole Harling with the Parent Advocacy Program. I have my guests here today, Dr. Honor and Robert Barbera. Thank you so much. Dr. Honor, let me ask you, what do you do or what does a parent do if they see there's a problem with their child's vision?
They're going to talk with their pediatrician and usually get referred to a pediatric ophthalmologist. And our job is to evaluate the child, to figure out if there's something that we need to do either medically or surgically to treat the condition. More importantly, if I diagnose a child as being visually impaired, I want to allow them to know what the resources are in our community. We're very lucky here in Western New York to have quite a few different resources available for parents. For the children who are 3 and 4 years of age, there's a visually impaired preschool in Amherst, and that's an excellent program. Parents can go visit that school.
What is it called?
The Visually Impaired Preschool, although I think the name recently changed.
They're still the visually impaired preschool. They are through the Olmsted Center for Sight, and their contact information is 836-7556 is their phone number.
Where are they located in Amherst?
They're on Sweet Home Road.
700 Sweet Home Road, right in Temple Beth. What is it?
Temple Beth Side.
Oh, okay.
It's between Sheridan and Maple Roads.
Off of Getchville. Yep. Okay.
So that's one resource that's available. And also for the parents of the school-age children to know that through the Commission for the Blind and Visually Handicapped, through Mr. Barbera's agency, we can get the parents in touch with teachers for the visually impaired so that the children can learn appropriate to their needs, either how to use Braille. We sometimes will get them into a low vision optometrist. There are 2 very good doctors here in Western New York who can help find what types of magnifying devices may help them. There are computer programs now that are very useful for the students. Some that are put in the classroom, sometimes they get a system at home as well. And it's really my role to get them into the different agencies. And one of the things I do is if I declare someone's legally blind, that opens up a lot of services through Mr. Barbera's agency to be able to get them the help they need.
Mr. Barbera, could you elaborate on some of the services? I know you mentioned during break SABA, if I pronounced that correctly.
Yes, there are a lot of different agencies that we can contract through. First is we mentioned the low vision examination, which there are 2 ophthalmologists, and we would want to link them up with either one of those 2, depending on what. Actually, there's a few of them, depending on where they live and client choice. We might want to fund for some of the kids that are at least 5 years old or older. We might want to fund for rehabilitation teaching, which would be a teacher to come in the home for a limited amount of time, which to teach the kids independent living skills. When they're maybe 12, it might be using the microwave or cooking something on the stove. If they're 5, it might be helping the parents show them how to tie their shoes and learning to do things non-visually. Maybe learning to independently dress and match their clothing up if they have difficulties with colors or things like that. A lot of what I might do is advocate for services through the school district and make sure the school district is providing those services. If they need orientation and mobility or cane travel, is another way to say that, then I want to make sure the district is providing that service. I'd want to make sure that the district is providing any type of computer technology if the child's going to be using computers, which would either be a voice program or screen enlargement programs. I would want to make sure that the child's getting all the services in the school districts, but also we can fund for a year of social recreation, and it can either be through the Skating Association for the Blind and Visually Handicapped, which is SABA, or Moving Miracles, which is therapeutic dance, or of the various therapeutic horseback riding centers out there. We can also fund for activities if the child wants to. I have a lot of kids that want to do ballet dancing, so they don't have to go through an agency that specializes in disabled. I've had kids do ballet, I've had kids do taekwondo,
Wow.
and do it through private providers that are willing to work with us. Occasionally they might want to take like music lessons. We might even encourage them to do the normal things like Boy Scouts,
Absolutely.
Girl Scouts, all those kind of things. So we can help fund for a year worth of those programs. As they get older, we'd want to focus on summer camps, which there's a wonderful sports camp in Brockport, New York. The woman teaches in adaptive phys ed, and it's called Camp Abilities, which is a wonderful sports camp for kids 9 years old and up. Obviously in this area we also fund for Cradle Beach camps. We can fund for some of our older kids that are maybe 11 and on up. We fund for what's called the Adirondack experience, where they can go and do some rock climbing and mountain climbing and learn a little bit about independence and also learn about teenage type things.
Yeah.
So, and then of course as they get older, we fund for the transition programs through our summer work experiences. We do a lot of contract with the Olmsted Center.
Do you have any programs for parents only, like a parent support group?
I'm glad you mentioned that.
Okay.
I just organized a parent support group, and I have a wonderful group of parents that have hopefully are taking on an active role right now. And we had our first parent meeting, and I organized an event to have a rehabilitation teacher talk with them, an orientation mobility instructor. I had someone discuss the various social recreation programs. I asked someone to come in from the Early Childhood Direction Center who is also a parent of a visually impaired child. And I also asked for the adaptive technology people from the Center for Assistive Technology at UB. So it was a really great program. The parents were really proactive.
It sounds like they were really receptive to knowing that
They
someone's
were.
out there.
They were, and the best part is I'm trying to empower them so they can take on the events and come to me and say, we want to organize these things. So I've even had parents, we've done in the past, we've organized summer picnics, we've rented out a roller rink. We typically, one Saturday in usually February, we rent out Cold and Tubing and rent the hill for an hour and
That's
take the
fun.
kids tubing. So a lot of it is empowering the parents and empowering the families, and it's also good for them because the parents can meet other parents who have children who are visually impaired or legally blind, and then the kids get to meet other kids.
Okay.
And it's good. It works on both ends. So I'm very fortunate now that I believe that I'm going to have a very active group of parents who are going
Sounds
to
like
organize
it.
things, and I encourage all the parents to try to get involved in that.
If both of you all, and I'll start with you, Dr. Honor, if you can let the audience know one message, if they are in this situation, and there's several situations, I don't want to put it all under one umbrella, what message would that be?
I would tell parents if they have concerns about their child's vision, the first person they should turn to would be their pediatrician or family physician. That's the person who knows the most about the family, knows about the child, and can then direct them as they feel appropriate to an ophthalmologist like myself,
Right.
or whomever they think is appropriate for that situation.
And what about you, Robert? One message you want to give to the audience who, for example, they found out their child is legally blind. What would you tell that parent?
I'd tell them that there's hope, that the most important thing is that you do the best for your child, and that there are services out there that will help your child live a normal life that you would expect of any other child.
Perfect. Now, Dr. Honor, when a child has a disease in the eye, it doesn't mean that they're going to go blind, of course. It doesn't mean that they have to wear corrective lenses for the rest of their life. I mean, I know probably some parents may come in and think of that. What do you tell them after they see their pediatrician and then they come to see you? What do you tell them in regards to the progression? I know it all depends on what they have and so forth, but can you elaborate on that?
Sure. There are certainly children who are getting glasses for, let's say, nearsightedness, and those children are going to be wearing glasses forever. But as teenagers, they might be able to get contact lenses. As most people are aware now, for adults, there are different surgeries called laser vision correction that can be done to help people sometimes get out of glasses. For the children who need to wear a patch, we have some children who won't wear the patch, not very surprising. We actually do something with a drop called atropine, where we have the parent put a drop in the good eye once a morning. It blurs the vision in the good eye and allows the child to develop vision in the other eye. And most people wouldn't even know that that was happening. They might see the pupils larger in one eye, but those children seem to function very well.
So it's kind of like a fake patch, if you will.
It's a way to use pharmacology to patch the eye.
There you go.
Okay. So that's very helpful. I want to just echo what Mr. Barbera said. I think one of the important messages for parents with children with any kind of visual impairment is that they're not alone. There are other families out there who have experienced the same thing they're experiencing, and there are other families who they can turn to as a resource. We're the professionals and we're here to help guide parents, but sometimes they need that other family who's gone through the same thing.
Absolutely.
There are support organizations out there for even specific diseases, where groups of families whose children have the same condition have formed groups on the internet. And I know parents come in and tell me that they've met other parents on chat rooms for specific diseases. So that's very helpful. And the internet has really changed the way parents access that information. So
information is there.
They find out about new treatments. They find out about what other families have experienced. And it's helpful too to sometimes find a family who has a child with a similar condition. Maybe that child's now a teenager and a new family comes in and their child's an infant. And so if they get to meet this other family, they see, oh, this is a healthy young teenager. It helps give them the perspective that while this can be a devastating thing to learn about, there is a lot of hope there. I don't think there should be limitations on these children.
Absolutely not. Absolutely not. And in your case, Robert, just to touch on, you mentioned to me earlier that you were one of the first children in Western New York to be integrated in the Buffalo school system. Was it Buffalo, right?
Yes.
And not segregated because of your disease. I want to leave it there. I want to thank both you guys for coming today, letting the parents know that there's hope out there. See your pediatrician, and definitely look out for the various services that you all offer and other agencies offer to parents that may have children with eye problems. So again, thank you for coming, and I appreciate it.
Thank you for the opportunity.
Thank you very much. And come back, audience, for our next show. Thank you for joining this one.